Hello, my name is Dr. Dewan S. Raja. Today I will discuss about tumor lysis syndrome. Tumor lysis syndrome is a potentially life-threatening medical emergency that can occur as a complication of cancer treatment. So it is a complication of chemotherapy. It is most commonly associated with treatment of hematologic malignancies such as leukemia and lymphoma, like Hodgkin's lymphoma, non-Hodgkin's lymphoma, but it can also occur in solid tumors. Tumor lysis syndrome results from the rapid breakdown of cancer cells, release of large amounts of intracellular contents into the bloodstream. The body may not be able to eliminate these substances, so there will be metabolic imbalance. The key components released during tumor lysis include potassium, phosphate, and nucleic acid. So, what are the risk factors for tumor lysis syndrome? High tumor burden. Patients with a large tumor burden are at a higher risk of developing tumor lysis syndrome, like leukemia, lymphoma. Highly responsive tumor that respond rapidly to treatment are more likely to release significant amounts of cellular contents into bloodstream. Chemotherapy. Certain chemotherapeutic agents, particularly those that are highly effective against rapidly dividing cancer cells, can trigger tumor lysis syndrome. Examples include drugs like cytarabine, fludarabine, and others. Dehydration. Inadequate hydration can exacerbate the risk of tumor lysis syndrome, as it impairs the body's ability to excrete the released substances. The complications of tumor lysis syndrome include hyperuricemia, too much uric acid, because due to cell breakdown there will be release of nucleic acid that will be converted into uric acid, and there will be hyperuricemia that may even precipitate in the respiratory, in the urinary system, in the kidney, ureter, bladder area. So in that condition there may be chance of development of uric acid stone in the renal system. Hyperkalemia, hyperphosphatemia, and hypocalcemia. This balance can lead to severe renal dysfunction. So due to precipitation of uric acid, the renal tubule may be blocked, or cell debris may block the renal tubule. Okay. There may be chance of severe renal dysfunction, cardiac arrhythmia, seizure, and even death if not properly treated. Precipitation of uric acid is favored by acidic pH. We know that our urine pH is acidic. Collecting tubule, acidic pH in collecting tubule. Preventive measures for tumor lysis syndrome include aggressive hydration. No hydration, no chemotherapy. It should be given intravenously. The use of uric acid lowering medication, allopurinol or resburicase. And also, when we'll push the chemotherapeutic agent, it should go slowly. Not too much doses of chemotherapy within a very short time. No, there is no rush. We'll go slowly push the exact amount of chemotherapeutic medication. Okay, the use of uric acid lowering medication like allopurinol or as boric acid that may be useful after the episode of tumor lysis syndrome, and the monitoring electrolyte level. In some cases, prophylactic measure may be initiated before the start of cancer treatment in high-risk patients. Okay, so management involves supportive care, including intravenous fluid that should be given generously, electrolyte monitoring if necessary, intervention to correct imbalances. In severe cases, renal replacement therapy may be required. The crucial for healthcare provider to be aware of the risk factor, monitor patients closely, and take preventive measures to minimize the occurrence of tumor lysis syndrome. Okay.